Want to pass your nursing fundamentals exam? Then let's get started. Today we'll cover 10 questions based on end of life care. Question 1. Which action is a priority when providing care to a terminally ill patient? Administer pain medication as ordered, discussing advanced directives with the patient and family, encouraging the patient to maintain hope for recovery, initiating aggressive life saving measures. Pause the video and select your answer. If you chose option B, you are correct. Discussing advanced directives with the patient and family. Discussing advanced directives allow the patient to express their wishes regarding end of life care, ensuring their preferences are respected. It promotes autonomy and informed decision making. Question 2. Which statement by a family member indicates understanding of hospice care? Hospice care focuses on curing the patient's illness. Hospice care provides comfort and support for the patient and family. Hospice care is only provided in hospitals. Hospice care is initiated when the patient is expected to recover. Pause the video and select your answer. If you chose option B, you are correct. Hospice care provides comfort and support for the patient and family. Hospice care emphasizes comfort and quality of life for terminally ill patients, providing physical, emotional, and spiritual support to the patient and their family members. Question 3. What is the nurse's primary role when caring for a dying patient? Administering medications for pain relief, providing emotional support to the patient and family, ensuring the patient is eating and drinking adequately, facilitating communication between the healthcare team. Pause the video and select your answer. If you chose option B, you are correct. Providing emotional support to the patient and family. The nurse's primary role is to provide compassionate care, emotional support, and comfort to the patient and their family during the end of life process. Question 4. What is a common physical manifestation of approaching death in a terminally ill patient? Increased appetite, increased respiratory rate, improved cognitive function, decreased urine output. Pause the video and select your answer. If you chose option B, you are correct. Increased respiratory rate. Increased respiratory rate, known as Cheyne-Stokes breathing, is a common physical manifestation of approaching death in terminally ill patients. It is characterized by periods of rapid breathing followed by periods of no breathing. Question 5. What is the primary goal of palliative care? Cure the patient's illness, prolong the patient's life, provide relief from symptoms and improve quality of life, provide aggressive treatment interventions. Pause the video and select your answer. If you chose option C, you are correct. Provide relief from symptoms and improve quality of life. Palliative care focuses on relieving symptoms, managing pain, and improving the quality of life for patients with serious illnesses, regardless of prognosis. Question 6. What is an appropriate nursing intervention for a dying patient experiencing dyspnea? Encouraging the patient to take deep breaths, administering oxygen therapy at a high flow rate, elevating the head of the bed and providing a fan, administering a sedative medication. Pause the video and select your answer. If you chose option C, you are correct. Elevating the head of the bed and providing a fan. Elevating the head of the bed and providing a fan can help improve air circulation and ease breathing for a patient experiencing dyspnea. Question 7. Which statement by a nurse demonstrates therapeutic communication with a dying patient? Don't worry, you'll feel better soon. I'm here for you. Would you like to talk about how you're feeling? You shouldn't be afraid. Everyone goes through this. Let's focus on positive thoughts to help you get through this. Pause the video and select your answer. If you chose option B, you are correct. I am here for you. Would you like to talk about how you're feeling? This statement acknowledges the patient's feelings, offers support, and invites the patient to express their emotions, demonstrating therapeutic communication. What is a common psychological response of family members to impending death of a loved one? Denial, acceptance, joy, apathy. Pause the video and select your answer. If you chose option A, you are correct. Denial. Denial is a common psychological response to impending death, as family members may struggle to accept the reality of the situation and may initially deny or minimize the severity of the prognosis. Question 9. What is an appropriate nursing action to provide comfort to a dying patient? Administering frequent vital sign assessments, positioning the patient to relieve pressure, restricting visitation to prevent overwhelming the patient, encouraging the patient to maintain a strict diet. Pause the video and select your answer. If you chose option B, you are correct. Positioning the patient to relieve pressure. Positioning the patient to relieve pressure helps prevent pressure ulcers and promotes comfort during the end of life period. Question 10. What is an appropriate nursing intervention to address spiritual needs in a dying patient? Encouraging the patient to engage in religious rituals, avoiding discussions about spirituality to prevent discomfort, providing distraction through entertainment, administering pain medication as needed. Pause the video and select your answer. If you chose option A, you are correct. Encouraging the patient to engage in religious rituals. Encouraging the patient to engage in religious rituals or spiritual practices can provide comfort and support during the end of life period. Click that subscribe button and join us next Friday.